Hey everybody, Mike Greenwood from Vance Thompson Vision in Fargo here, talking to you about what to expect in the post-op period after having interventional glaucoma. And we'll kind of break it down into three categories depending on which type of intervention you had. So going from sort of least invasive to most invasive. If we're talking about SLT or DSLT, what to expect afterwards, the procedure itself is relatively quick. And immediately after the procedure, you might feel a little blurry vision. If we're doing SLT, sometimes there's some gel in the eye we have to rinse off, or with DSLT, the eye can get a little bit dry. But immediately after, again, you might have a little blurry vision. That'll go away within a couple minutes. The might be a little sensitive to light for the next couple days. If you're around bright lights, things like that, you can be a little sensitive to light. And usually that's about it. Very, 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 very rarely people can have a pressure elevation. And if that happens, you might have a little bit of a brow ache, or your vision might be a little bit blurry a day or two after the procedure. But again, that's extremely rare. So in most cases, it's very minor. If you have a sustained release device like a Durista or an iDose, then there's really not a whole lot to think about. Immediately after the procedure, again, might be a little bit scratchy from where we have to enter the eye, either with the needle or with a small incision. But again, that goes away usually within 12 hours or so. And then, again, in general, most people do really, really well. Occasionally, and again, this is very, very rare, people can have a little bit of an inflammation following the procedure. And if that's the case, then the eye might be a little bit red, sensitive to light, irritated. And if that's the case, come on in and see us or your local doctor, and they'll take a look and let you know. And then the last category we'll talk about is kind of the minimally invasive glaucoma surgeries. And there's a whole bunch of them, but iStent, Omni, Via 360, KDB, you name it. These are the ones that treat the trabecular meshwork and help lower IOP and get people off medications, just like the other things we talked about. Again, with these procedures, you'll have maybe a little bit of scratchiness, irritation immediately after the procedure, the surgery, and that usually goes away within 12 to 24 hours. Your vision might fluctuate a little bit because there can be a little bit of swelling when we do these procedures. There can also be a little bit of blood reflux inside the eye. That goes away, and that's usually a good sign. That means we've got good communication with the drainage system, so that should help lower the pressure over time. But again, after a day or two, your vision should get back to baseline. Your vision won't get better from having these like it will with cataract surgery, but again, the goal is just to lower your eye pressure or get you off of some of your medications, or both. But again, it won't really affect your vision other than having a little fluctuation for a day or two while you're healing. And then, of course, with all these procedures, it's important to follow up with your regular routine care, usually a week or a month after these procedures, and then depending on the level of your glaucoma, how often you need to be seen. But overall, lots of different options, and people do really well with relatively quick healing. Thanks for listening.